Welcome back. With more than 1/3 of adults in the U.S. considered obese, more and more Americans are heading to a surgeon's office seeking weight loss surgery to help them drop some pounds and achieve better health. Bariatric surgery can be a lifesaver for some people. We're here with Dr. John Schramm and his patient Jim Root to discuss weight loss and Jim's story. Of course, weight loss surgery was Jim's only means we're hearing to qualify for the open heart surgery that he desperately needed. So good morning to you, Dr. Schramm.
Good morning, Leanne. Thanks for having us.
Absolutely. So what exactly is weight loss surgery, bariatric surgery more specifically?
Yeah, so basically it's an operation or a variety of operations that we do on patients' digestive system to create a tool that will allow them to diet more effectively.
And then who should really start considering this?
Well, today, patients who are at least 100 pounds overweight, have a BMI over 40, or those who have a BMI between 35 and 40, roughly 75 pounds overweight, who suffer from things like diabetes, high blood pressure, sleep apnea, are all considered candidates for this operation, and most of the time then will qualify for insurance coverage for the operation.
And I know we've heard stories in the past about people who have gone this route. Of course, what are the advantages to getting this weight loss surgery?
Well, as we know that, when people attain that type of obesity, they have about a 2 to 3% chance of being successful with non-operative weight loss programs and actually getting down to a healthy weight. Whereas with the surgery, 90% of the patients who we operate on will be able to keep at least half of their excess weight off. So it really gives them their only real opportunity to have lifetime success with weight loss.
And why is Spectrum Health the best route for someone who wants to do this?
Well, we have a comprehensive program. We've been an accredited program for many, many years, probably one of the most experienced programs in all of Michigan. And I think what sets us apart is, just the depth of the tools that we have within our program, whether it's, experienced surgeons, dietitians who have been taking care of patients for many years, psychologists on our team. We have a whole medical weight loss division within our team. So we try to provide a comprehensive program that will follow patients for the rest of their life. I tell patients it's not just about doing an operation and saying goodbye, good luck, see how you do, but we actually want to follow people for the rest of their lives to make sure they have great long-term success.
And we need to get to Jim here in just a second, but real quickly, when you hear surgery, that's scary to some people. So real quick, if you can get a hit on how they're performed and maybe just a couple of the risks.
Yeah, surgeries actually are very common now. They're done laparoscopically, very similar to gallbladder surgery. And the operations that we do for weight loss really carry about the same risks as a gallbladder operation.
Wonderful. Okay. And let's hop over to Jim real quick, and then we'll bounce back to you, Dr. Schramm. So, Jim, thanks so much for joining us on the show. What convinced you to really look into bariatric surgery?
Well, good morning, Leanne, and thank you for having me. I guess a lot of things convinced me. First of all, as far as my history and a little bit of my struggle, it was probably somewhat typical. I grew up on a working dairy farm in upstate New York, and at 6'3" tall, very active and successful in sports all through high school, college, and my adult life. However, as is common with a lot of people, and as I became older and less active, I started to gain the weight. Also 12 years ago, I started traveling for a consulting job, which took a toll on my healthy lifestyle and contributed to my extreme weight gain. Eating fast food, junk food, very little exercise. I was really out of control. So that really helped drive me to this. My weight actually increased until it maxed out at 390 pounds, which was morbidly obese, BMI of over 50. In addition, I had some of the other health issues that Dr. Schramm just mentioned: high blood pressure, high cholesterol, sleep apnea, and all kinds of mobility issues increased. I'm a musician playing tenor saxophone in both the Holland American Legion Band and the Scottsville Clown Band, and I couldn't even make it through an easy parade route anymore. It became harder to go up and down stairs, get in and out of the car, and I also needed knee replacements, which I couldn't get because of the weight. So a lot of that contributed to my decision. So
where are you at now, weight-wise?
Weight-wise, right now, I am at 285 pounds.
Wow, look at you.
Initially, I lost 120 pounds. I'm up slightly from where I was due to the pandemic and being at home working isolated, but the VSG, vertical sleeve gastric surgery, was a tremendous help for me.
Wonderful. Well, I'm so glad. I can tell, I can see the bright smile on your face and the vibrance. It's great to see that you're back in action. And thank you so much for sharing your story. Real quick, I want to bounce back to Dr. Schramm. All right, Dr. Schramm, you guys obviously have a team approach there when it comes to each case. I'm sure each case is different. So what advice would you give to someone considering all this?
Well, I think, you have to determine whether or not this is the right thing for you. And if you've been unsuccessful with weight loss on your own, and you struggle, have a BMI over 35 or 40, have diabetes, hypertension, sleep apnea, and are really looking for something that will work for you, then I think it's something that you should consider. It's very easy to get involved. We have seminars, almost every day of the week, and just learn about the possibility. But I think what people need to know now is that this is an operation that can be done very safely on almost all patients. And you've got a extremely high likelihood of being able to get rid of problems like diabetes and high blood pressure and sleep apnea. The things that really make life miserable for a lot of our patients can actually go away now.
Wonderful. Well, thank you so much for your time this morning.
Pleasure.
Absolutely. And to learn more, to attend a seminar, here's what you can do. You can go ahead and call them 616-267-7400. Visit them online at spectrumhealth.org/bariatrics.